Hello, everyone, and welcome to the Community Matters Understanding Social Determinants of Health to Reduce Dementia Risk webinar series. Next slide. I'm Mikkel Lewis. I'm an Associate Director for the Bold Public Health Center of Excellence on Dementia Risk Reduction with the Alzheimer's Association. Next slide, please. I would like to take this opportunity to highlight current opportunities for local health departments. You'll see here that we have the Risk Reduction Learning Collaborative application. It does close in only 9 days on August the 2nd, but this is a travel scholarship for local health departments, and this is an opportunity to train on community action planning meetings focused on dementia risk reduction. So please make sure to scan this QR code, but don't worry, we'll also include the link in the chat so that way you can view it, as well as we'll include it in the email recap. Next slide, please. We are focusing on nourishing minds, exploring nutrition and food security's role in dementia risk reduction on today's webinar series. We'll hear from our academic experts as well as the health department speakers just to help us understand how these practices are happening. Next slide, please. So please let us know where you're joining us from, as well as what is your go-to comfort meal that you would like to have often. I'll go first. I'm listening in from Detroit, Michigan, and my go-to comfort meal is spicy noodles. It is an Asian cuisine and it's very filling. Next slide, please. I would like to say that we have a few housekeeping items that I'm going to go through, but we want to thank you all for joining us today. We have over 1,200 registrants for today's session, and we're just so thrilled to have so many of you from diverse populations listening in. So first, this webinar is hosted by the Alzheimer's Association Public Health Center of Excellence on Dementia Risk Reduction and is funded through a cooperative agreement with the CDC. We are recording today's webinar, and we'll be sure to share the recording with webinar registrants in the email recap. And then if you would like to enable your closed captioning, you can do so at the bottom of your screen. And if you don't see that feature, please click the 3 dots at the bottom where you see more, and that should enable that feature. And then lastly, we'll go into the Q&A portion. So we do ask that you use the Q&A box so that way our speakers, as well as someone from our public health team, would be able to respond. So let me check the chat just to see where everyone's joining us from. I see we have a few people from Wisconsin. Oh, okay, Kansas. I see avocado rolls, as well as a few people from Seattle, Washington. Pad Thai, that's also a great dish. Ice cream, oh, that one's my favorite. And thank you all for just letting us know where you're joining us from. Keep it going as I continue to go through the agenda and the learning objectives. Next slide, please. So for the agenda today, I'll go through the learning objectives, introduce the speakers, and then we'll hear from our presenters, and then we'll open up the Q&A box for the Q&A session. Next slide, please. And today we'll be focusing on understanding the connection and the correlation between nutrition, food security, as well as dementia risk from our academic expert. And then from our health department speakers, we'll see how the health department is incorporating the work into practice within the community. Next slide, please. So today we have Dr. Puja Agarwal, who is a nutritionist as well as a nutritional epidemiologist at Rush Alzheimer's Disease Center. And she is also an associate professor in the Department of Internal Medicine at Rush University Medical Center. And we'll also hear from Ashley Hawes, who is the health director / health officer, as well as Megan Mermel, who is the public health strategist for Greendale Public Health Department. Now I'm going to turn it over to Dr. Agarwal on her presentation on nutrition and food security. Next slide, please.
Hello, everyone. Thank you for joining, and thanks, Mikael, for the introduction and having me here. So today, as the slide says, I'll be talking about nutrition and food security. And next slide, please. I will just go over mainly what do we know so far in terms of nutrition and dementia risk, the scientific evidence we have, and then we will briefly touch upon if eating unhealthy foods attenuate the beneficial effect of healthy diets. Then we'll move on and talk about the social determinants of health and how it may play a role when it comes to diet or what's in your plate. And then we'll talk about food securities and insecurities, and finally, how it is related to the dementia risk, given what's in the literature. Next slide, please. So I'll start off with what we have a good scientific evidence on. So there are different nutrients and food sources which have been looked at for its evidence on brain health outcomes, including cognitive decline, dementia risk, and other outcomes. And primarily, a lot of studies have pointed out that there's a significant role of certain specific nutrients, including vitamin E, omega-3, a part of subgroup is DHA, the dihydroxyuronic acid, primarily found in fish. Then we have good evidence on folate, the saturated fats. That's the one which you should consume in limitation. The carotenoids, which are the colorful pigments in fruits and vegetables. The flavonoids, which are the bioactives, vitamin D, trans fat, monofat, and polyphenols. Next slide, please. So over the few next slides, I'll go over what's known and what we have found and what other studies have indicated for these specific nutrients. So up top on the left, you see vitamin E intake and cognitive decline. So when I'm showing such graph, it means the association of vitamin E intake with the cognitive decline. So the pink line includes people who were consuming the lowest amount of vitamin E, the lowest quintile, and compared to those in the highest, which is the green and the black line, the top two quintile, we found those in the lowest quintile were declining faster. So the line is indicating your change of cognition over time, which was significantly more or faster for those who were consuming less of vitamin E intake. Similarly, there have been a lot of studies on B vitamins. So what I've picked here is a meta-analysis, which combines a lot of other studies and shows that the B vitamin is associated with slower cognitive decline. Then we have enough compelling data on omega-3 fatty acids and cognitive decline. So the DHA is one of the significant one, which has been shown in this meta-analysis to have a role in both cognitive decline as well as reducing dementia risk. Next slide, please. Now coming on to another nutrient, that's dietary carotenoids. You might not be familiar with all these terminologies, but then dietary carotenoids is one of the pigment nutrient. It's an antioxidant nutrient, primarily present in a lot of colorful fruits and vegetables. And in our cohort, which is Rest, Memory, and Aging study at Rush, we specifically looked at if these carotenoids are associated with dementia risk. And as indicated on the first graph, the first bubble up there, we compare the quintiles, the highest consuming group compared to the lowest consumption group. There was a significant decline in dementia risk by almost 50%. And similarly for the specific carotenoids, so there are a group of carotenoids, for example, lutein, alpha-carotene, beta-carotene, and we specifically found that for lutein, zeaxanthin, there was a significant association for reducing dementia risk in our cohort. Next slide, please. And then further, we do also have some evidence on the bioactives in the food. So these bioactives are the compounds which have different mechanisms through which it can impact your brain health. They mostly the mechanisms are through decreasing the oxidative stress and inflammation, neuroinflammation. And what we looked at in the cohort Rush Memory and Aging Project was if there's some specific ones. Here I'm showing you the dietary flavonols and dietary pelargonidins. So flavonols are primarily present in green leafies, beans, tea, broccoli, apples, oranges, tomato, pears, olive oil. And these were the specific questions we asked our participants and looked at the flavonoid intake and if that is associated with dementia risk. And in figure 1, you can see the quintile 5, which is includes people who are consuming the most amount of this specific flavonoid, the dietary, that which is called flavanol, had a reduced risk of dementia over time when we are comparing it with the Q1. So it's just to simplify the step which is on the top versus the step which is at the bottom. Similarly, in figure 2, we kind of show the similar association with one of the anthocyanidins we have. So anthocyanidins are another group of flavonoids. We are specifically looking at pelargonidin, which is primarily present in berries, peas, beans, raisins, and grapes. And we found that people who were consuming more of these, this particular flavonoid called pelargonidin had reduced risk of having Alzheimer's dementia. So again, the red step compared to the blue step. The blue is the people who are consuming low, and the red is consuming more. So you can see the rate of having dementia is less for those in the red line. Next slide, please. We also looked at actually sugar intake. So until now, I have talked about the nutrient which you should include in your diet. But then there is also literature on the foods or nutrients which you should limit. So sugar intake is one of the things which have been considered not good for your health outcomes, not just the brain health outcomes, but for other vascular outcomes as well. And in this study, we wanted to look at if the sugar intake is also associated with dementia risk. And using the same cohort, the Rush Memory and Aging Project, on which we do follow people for longitudinal years. So here, for example, we have followed them for almost 12 years. We looked at their diet at the baseline at one point, and then followed them with their cognitive assessments every year. And dementia clinical assessments, and found that those who were consuming more sugar, and this was the total sugar intake, and it was controlled for all the confounding variables we have for other lifestyle factors and other risk factors. We found that those who were consuming more had overall higher risk of having dementia. So next slide, please. Now I'm moving on to our second objective, which is to look at if unhealthy foods may offset the beneficial effect of the healthy components in our diet. And this is the study which we have done in another cohort at Rush, which is called Chicago Health and Aging Project. So primarily looking at if the Western diet, which is primarily red and processed meat, butter, fried food, and this diet is high in refined and sweet foods. We wanted to see if people who are consuming more of Western kind of diet do have a similar effect of the healthy diet. So Mediterranean diet is a healthy diet, which consists of more of fruits and vegetables and legumes, olive oil and fish. Because in our group, these correlations indicate that the correlation between Mediterranean and Western indicate that in the Mediterranean diet group, we had few people who were still consuming more of the Western kind of foods. So we wanted to see if there is some kind of interaction. And next slide, please. So in the results, we found that when we there was a significant interaction. I'm not showing the interaction here, but then these are the stratified results. So we divided these people. These are good amount of, like, we had like almost 5,000 people in this cohort, and we are then stratifying them based on the Western diet high versus low, and then looking at if consuming a Mediterranean diet is associated with cognitive decline. From previous studies, we do know that healthy dietary patterns such as Mediterranean diet and the MIND diet is associated with better brain health outcomes. However, in this group, when we look at after stratifying them, we found that people who were consuming low Western diet still have that association of Mediterranean diet slowing down the cognitive decline over time, as indicated by these colorful lines. So if you compare the blue line versus the gray line on the left graph, it is a steeper decline for the blue line versus the gray line. So that means the Mediterranean diet, the low Mediterranean diet people are declining faster. However, in the high Western diet group, we did not find a significant association as we were expecting. So that's why we concluded that the unhealthy component of these Western diets may be attenuating the beneficial effect of the Mediterranean kind of healthy diet among these participants. Next slide, please. Okay, so this was all about the nutrition and the nutrients we know, and if the healthy and unhealthy diets overall interact, and if that impacts your cognitive health outcomes or dementia risk. Now we are moving to another piece of our talk here, which is about the social determinants of health. I think most of us do kind of know what they are, but just to emphasize why it is important when we're talking about diet, because diet does varies by socioeconomic status, the environmental factors, the social factors, by neighborhoods, and by geographical location, by race and sex also. So overall, it impacts your accessibility to food, and then if anybody can afford these kind of healthy food items, which we are talking about, if they should eat to reduce dementia risk. And then there is neighborhood environment. How many fresh food markets are there? Are they accessible? Or how many fast food joints are there? So overall, how is the food environment for the area where you live in plays a role. Your individual knowledge or your overall knowledge and time and resources to prepare any kind of healthy meal plays a role. The food services available to older adults. When we talk about dementia risk, there are different programs ongoing. I'll talk about them in the later slide. And then another important thing is social support and environment. That also impacts your diet and what's on your plate. Next slide, please. So now I'll go over a few studies that have actually looked at some of these aspects. So for example, this study is looking at the food environment in older adults and how that plays a role in obesity. And what this study found was the presence of supermarkets were associated with lower prevalence of obesity, and the presence of convenience store was associated with higher prevalence of obesity in older adults. And particularly, this indicates that because supermarkets have fresh produce and other healthy food options, probably that indicates the role of food environment and obesity in older adults. Next slide, please. Then further, another study actually looked at the food environment and its association with cognition. So surprisingly, they found something opposite, but I'll just briefly mention what they did. They used a retail fast food environment through kernel density method. It's a specific method of identifying the fast food environment. And this was done in REGARDS study. It's a longitudinal cohort study in the stroke belt, the US. And all participants have this information on their environment, food environment, and also cognitive function. However, if you can see, the lines are going up. So having more of these fast food in stores were associated with better cognition. However, authors do address that they have not accounted for a lot of other confounding factors in this analysis, such as local retail food environment, the walkability to your stores, or proximity to other grocery stores, recreational facilities, and healthcare. And they They also indicate in the paper that local coffee shops and fast food restaurants may critically support the health and well-being through mechanisms of stimulation, support, and protective healthcare. So again, indicating that having a coffee shop does not really only indicate having a bad diet kind of thing, but it might be adding some other characteristics such as like socialization among these people or like overall other stimulation activities that may have role in the dementia or cognition in these participants. However, there has been already a published study in the regards cohort, which looked at how Southern Western diet is associated with lower cognition, and they have actually shown that having more of the Southern kind of Western diet is associated with poor cognitive outcomes in this cohort. Next slide, please. So what we have now next is another study which was done in Einstein aging study cohort. That's another set of cohort which specifically looked at the objective measure of food environment and subjective measure of food environment. When I'm saying objective measure, it means like how many stores are there or like density of healthy food stores, as was done in the previous study. Now, the subjective availability of healthy food is your own consumption of fruits and vegetable, and then using a self-reported questionnaire filled by participants, like on like, do you have access to healthy food? So what they found is that both objective availability of food as well as subjective availability of healthy foods are important when we are trying to tease apart the relationship of food environment and cognition, specifically in older adults. Next slide, please. Okay, so now we are moving to our last section of the talk, which is food insecurities. Most of the times the food security, which is opposite of food insecurity, obviously, is interchangeably used by people. So I'll just start with food insecurity first, and then I might move to food security given what they have used in the study, the terminology used in the study. So food insecurity means not having access to the healthy food that is essential to live an active and a healthy life. We do know that food insecurity is associated with lower diet quality, less intake of fruits and vegetables, and lower intake of the essential nutrients such as vitamin A, the carotenoids I talked about, calcium, iron, magnesium. So we do know that food insecurity impacts your diet, and or previously we have said that your diet should have like more of greens, more of vegetables, more of colorful fruits, and other things which are essential for carotenoids and omega-3s, etc. So overall, food insecurity has been changing over the number of years, as indicated in this graph, but still we are still way behind than where we should have been. Next slide, please. So this slides indicate how food insecurity varies by different household marital status, race, and rural-urban breakdown. So in the bar graph or on the left, you can see that the low food security. Now here, the terminology used in this graph is food security. Low food security means having a food insecurity. So it's kind of like using it differently. But then what's shown here is that the non-Hispanic Blacks and Hispanics have higher food insecurities compared to the whites participants. And overall, from the national data set, the enhanced data set, we do know that among older adults more than 60 years, there is a food insecurity of almost around 24%. So this is like a serious issue for a public health perspective. Next slide, please. Again, just to add on, like why we do need to really hone on these specific things is because there is a persistent disparity when it comes down to food insecurity, as I've shown in the previous graph. And then other two graphs here also shows like how the red and the yellow line, which is for the non-Hispanic African Americans and Hispanics, is much higher than we go compared to the whites and other races. So so there is a disparity when it comes to food insecurities. And there's also disparity for specifically 50 plus older adults. If we see the year-wise change over time, it's more among Blacks. And we also know that there is disparity in diet. There are studies indicating that non-Hispanic African Americans and Hispanics have lower consumptions of fruits and vegetables. And overall, African Americans have poor diet quality when compared to whites. There is a lot of existing literature on dementia risk as well. So African Americans and Hispanic have higher dementia risk when compared to white. So overall, it gives us an overarching picture of why it is critical for public health in aging population. Next slide, please. Now we will go on the studies which have specifically looked at food insecurities and cognitive function as their outcome. And in this study, they have looked at the enhanced, that's the national data set we have, and looked at food insecurities association with cognitive function. So in this table, there are different tests, and overall the betas indicate that a negative beta means like the higher food insecurity was associated with low cognitive function. And that was across all the tests overall, and also for overall cognitive function. They found that food insecurity was associated with a lower cognitive score in these individuals. Next slide, please. And now this is a little busy table, but it's just to summarize because there are now a lot of other studies from different cohorts looking at food insecurity and how it is associated with cognition or cognitive decline or cognitive impairment. So this just summarizes like how there are other studies, for example, the Boston Puerto Rican cohort, the health outcome of people experiencing homelessness in older middle age study, which was Hope Home study, and they have used the 6-item food security questionnaire. The other studies have a lot of times used the 10-item, and these questionnaires are the tools provided by USDA. These are standard tools. You can go on the website and check them. But these specifically ask about your like how much food you can buy, and do you have enough money to buy foods, and some specific questions on food security. And they have found that food insecurity among older adults, most of the studies, I'll just do a gist for all of them together, that they found that higher food insecurity among these individuals were associated with more cognitive impairment or faster cognitive decline. And then recently, there has been another longitudinal study, including MASH and Cardia. That's another well-known, well-characterized study where they found, for MASH, they found persistent insecurity associated with cognitive impairment at the 2-year follow-up. And in Cardia, they found that cognitive insecurities at one point and then persistent and transitioning into food insecurity was also associated with cognition. And this association was directly or indirectly through depressive symptoms as well. So, so this is just to see like how there are like multiple pathways and different things happening with food insecurity among these older populations. Next slide, please. Okay, so this is one of the most recent analysis I found for food security. So now I'm switching the terminology of insecurity to food security because that's how the paper was published and that's how the results are here. So the food security, dementia risk, and memory decline in U.S. health and retirement study found that overall, very low food security or low food security, both with associated with lower with the odds of having dementia. And in the graph on the right, I know it's like very tiny, miny, and you just really have to get down and look at it. But the gray line, if you can see that gray line coming down, so everybody is declining over time, which is what one would expect as people age over time. But then for the gray ones, which is the very low food security group, when it was compared with other reference group, was declining faster. And they actually reported that this group, like the very low food insecurity group, was associated with almost 1 year of excessive aging per year compared to the reference arm. Next slide, please. So I just have briefly like a few thoughts on what is the possible mechanism linking food insecurity to adverse health outcomes. There can be like different things, obviously, but there's a good summary picture in the recent paper by Quan et al., which I have here. And then overall, the reasons why we do see these kind of associations again is because there are different nutritional pathways. We have first seen that how different nutrients and having a healthy diet is important to reduce dementia risk. And because of these different pathways, dietary patterns, poor nutrition can impact your brain health. And then apart from that, there are behavioral trade-offs. There can be like other things involved, anxiety, depressive symptoms, psychological pathways involved, and then how well a person is managing other stuff, like if there are pre-existing vascular conditions, because that also is impacted from what you eat. And definitely another thing to consider when we are talking about the mechanism is time is a resource, and like how these things are behaving and how many resources people do have to actually make a healthy meal or get all the healthy food on their plate. Thanks. Can you move to the next slide, please? Okay, so when we talk about like so till now we have talked about what's happening and then why nutrients are important, why having healthy food is important, and how different nutrients play a role, and how food insecurity is impacting cognition or dementia risk in older adults. But there are some initiatives for healthy food environments. So there is a huge initiative by CDC, primarily working on improving the accessibility to healthier foods. And there are different ways they have approached it, and it is an ongoing thing. They're improving the supply, driving consumers' demand for healthy foods has been taken care of, and these initiatives are important for community perspective and like having making sure that there is a healthy meal on everybody's plate. Next slide, please. So when we are specifically talking about some of these initiatives, one of them is Supplemental Nutrition Assistant Program, which is SNAP. Maybe some of you have heard of it. And I will just quickly go over it. So in this study, they have specifically looked at the older adults who are using this program, the SNAP program. They have found that among the non-users, so if we look at figure 2, specifically among the non-users, there was a much steeper decline of cognition over time compared to the users, which is the T line or the blue line. And that again indicates that older adults who are using the SNAP or the nutrition assistant program are performing better over time, again, because they are able to consume a better, healthier meal than those who are non-users. Next slide, please. With that comes my summary statement that overall we have seen how antioxidant nutrients, including vitamin E, carotenoids, and the bioactives, B vitamins, omega-3 fats, may help cognitive outcomes in older adults. It is important that when we are emphasizing on healthy foods to be consumed for better cognitive health, we also emphasize on the unhealthy food items such as processed meat, fried sugary foods, and refined grains. Different social, economic, and environmental factors may impact your nutrition intake or what goes in your plate. And there is food insecurity still in older US adults, and food insecurity is associated with poor brain health outcomes. It is important to address the barriers to food security, food accessibility, and diet quality among diverse older adults to reduce overall dementia risk. And I think that's my last slide. Next slide, please. Thank you. If you have more questions that you're not able to ask, you can email me. Thank you so much. And I'll stop here.
Thank you so much, Dr. Agarwal. And I really want to remind everyone that if you have any questions, please be sure to use the Q&A box for any of the information that Dr. Agarwal presented on. She'll be able to answer in the Q&A session after our next presenter. I would like to highlight the modifiable risk reduction video series. This is a series that Dr. Agarwal herself is featured as a research expert that highlights the new modifiable risk factor videos that the center has released. And please be sure to watch as well as share this series with your network. We'll also go ahead and include the link in the recap email as well as in the chat as well. Now, I'm going to turn it over to Megan and Ashley to hear about the work that's being done at the Greendale Public Health Department.
Thank you for hosting us today to talk about our efforts to combat dementia risk through our dynamic partnerships, our improved access to healthy food, and community education about nutrition's role in protecting brain health. Next slide. Over the next several slides, we will share our mission, our role, strategy, and talk about the evolution and evaluation of our efforts in our community. Next. So the village of Greendale, which is part of the Milwaukee metropolitan area in southeast Wisconsin, was established in 1938. The goal was to showcase a new kind of suburban living. Homes were conveniently located within walking distance of gardens, schools, employment, and the village center. According to U.S. Census Bureau data, Greendale has consistently had a higher percentage of older adults compared to both Milwaukee County and the state of Wisconsin. With a population of around 15,000 residents, our residents are known for their strong sense of community. We have a rich history, which makes Greendale an inviting place to live, where many individuals have grown up and then they choose to age in this community. Some residents are even second or third generation. At the Greendale Public Health Department, our vision is a healthiest and happiest Greendale. To move closer to this vision, we are leveraging valuable community resources and partnerships to improve access to nutritious foods through community gardens. Our initiative not only supports our residents' health, but also fosters community engagement and sustainability, hopefully ensuring that Greendale remains a vibrant and healthy place for all generations. Next slide. As public health professionals, one of our main roles is promoting primary prevention. Primary prevention is focusing on preventing health effects before they can occur. So some examples of this can include the use of bike helmets, engaging in physical activity, eating a nutritious diet, and being socially engaged and having those community connections. Next slide. Megan, you want to come off mute?
Sorry, thank you. Okay, the focus of this presentation is centered around community gardening. It's really so much more than that. Our community and health department have been working for years toward increasing access to nutritious foods, all while providing shared decision-making and leadership opportunities, promoting belonging and social connection, and building collaborative and reciprocal partnerships. On the next slide, I will share with you a timeline of events that include a focus on primary prevention, promoting healthy eating patterns, and increasing awareness through messaging. And then we'll take a little bit of a deep dive into the details of some of our partnerships. All right, we've already moved on to the next slide. So we put this into a timeline view. We wanted to take you down a quick trip down memory lane. I think this will just show everyone and give you a better understanding of the capacity that can be built in a community from this timeline perspective. All right, so from the beginning, in the summer of 2011, the Greendale School District established a school garden in a previously underused grassy area behind Greendale High School. With the support and expertise of the University of Wisconsin's Master Gardener, Extension's Master Gardener program, the Greendale Garden team set to work on creating and implementing their garden plan. This garden area was the ideal location for the school district to develop and maintain an outdoor classroom for use by students of various abilities and at multiple grade levels. In addition to their work in the garden, high school special education and job training students learn to prepare a variety of foods from the garden to share within the schools. So then moving along, based on the community health assessment in 2015, nutrition, healthy aging, and physical activity were identified as priority areas in Greendale. 3 groups were formed, one of them being a food and nutrition work group known as FANG, so it actually stands for Food and Nutrition Group. The FANG work group was guided by stakeholders from the Greendale Schools Garden Committee. Their goal was to increase the nutritional status of Greendale residents, and more specifically, their objective was to increase the percentage of adults and high school students eating the recommended number of vegetables in a day and in a week. The second work group, SAGE, which stands for Successful Aging in Greendale for Everyone, focuses on healthy aging. The SAGE work group's mission is to support innovative ideas to promote healthy and productive lives for Greendale residents, especially older adults. So then kind of moving along here, we have St. Thomas of Canterbury Church. Their members built a community garden in an underutilized space on their property, and their first growing season was in 2017. They had a total, or they still do, have a total of 36 plots that are available to community members for a small fee each year. Our health department assisted the garden committee in handling registrations and served as a liaison between the community and the garden committee. The St. Thomas of Canterbury Gardens were such a huge success, so much so that there was an abundance of crops, and unfortunately there was a lot of waste because of this abundance. So rather than seeing the produce go to waste, the Greendale Public Health Department partnered with the gardeners at St. Thomas of Canterbury to develop a produce donation program. Community gardeners were encouraged to donate their excess produce from their garden plot to this program to benefit older adults who attend and participate in our Greendale Senior Social Club. This process involved health department staff taking a cooler loaded with ice packs and containers to the garden one morning a week and picking it up in the afternoon on that same day. We stored the produce at our health department and then delivered it to the Senior Social Club the following day. A policy and some signage were created, and the information was communicated to the gardeners so they knew what to do. The same summer, a health department intern created a summer vegetable cooking demo for the Senior Social Club participants. This included surveying the participants to determine what tools and appliances they frequently used in the kitchen, the demo itself, and a survey following the demo, including asking for their feedback about the produce donations they had been receiving. The responses were primarily positive, and the older adults were very appreciative of the program. One fun piece of advice that we collected was that we had been bringing the members of the social club too much kale all summer. They weren't very fond of it, and they really did not know what to do with it. So that was kind of fun. So gardeners from the St. Thomas of Canterbury Garden were also invited to give their feedback on the produce donation process at the end of the season. So this leads us to the third community garden in Greendale. It's called the Greendale Children's Garden, and it was established in 2019 in another very underutilized space behind the shops in our main downtown area. The Greendale Children's Garden was formed for the child in all of us by a group of dedicated Greendale volunteers. So I'm going to pivot back now to our successful aging work group, which had a passionate group of members that wanted to focus specifically on the topic of dementia. They had formed a subgroup of SAGE for a dementia focus. As an initiative of theirs, they hosted a community presentation featuring the Mind Diet and the link to optimal brain health, which was facilitated by Dr. Piero Antuano, who is a neurologist in Milwaukee, Wisconsin. This presentation was extremely popular in our community. We had about 100 participants in attendance. Moving along to 2021, realizing the alignment between their initiatives, our food and nutrition group, and then our physical activity work group combined efforts to address both physical activity and nutrition, and they would come together under the name of Step Up to Better Health. Around the same time, the Greendale Children's Garden was invited to become a member of Step Up to Better Health and their work group, and they began contributing produce to the Greendale Senior Social Club as well. Moving into spring of 2022, our successful aging work group and the Greendale Public Health Department hosted a community convening series of sessions. These sessions engaged partners from a variety of sectors in the community, and they took part in a rapid strategic planning process around reducing dementia risk and promoting brain health. Also, we wanted to note that at this point, our community had built the capacity for our work groups to fully take on the ownership of the produce donation process. Wrapping up, for me, in the fall of 2022, our health department was awarded the Healthy Brain Initiative Roadmap Strategist Grant, where we increased and elevated our initiatives to reduce dementia risk. Our project was heavily woven into our community health improvement plan. Part of the project involved creating a micro grant program to support community organizations. Greendale Schools Garden and the Greendale Children's Garden both applied and were awarded funding. Since gardens are such a strength in our community, we wanted to leverage that to increase our reach with brain health information. We focused on spreading the message of what's good for the heart is good for the brain, and collaborated on several events. One event was a salad building demo and activity led by the Step Up to Better Health work group members with the Senior Social Club. The participants were provided with education on nutrition and how eating patterns can be protective of brain health. We also held a summer social event in the Greendale Schools Garden, and this collaboration involved our staff presenting to high school culinary arts and baking and pastry students about nutrition for brain health, and in turn the students took that information to find recipes, cook, and co-host an event in the garden that was open to the community to attend. So to date, our 3 community gardens have contributed thousands of pounds of produce to our school's food service program and to older adults in the community. Bringing us to the present time, we're focused on sustainability and aim to build upon our successes. We know that many people really need ongoing support to maintain healthy eating patterns, and we intend to continue to prioritize our community-based approach. Next slide.
Thanks for that great recap, Megan. We did a lot of really exciting and amazing things, but it is important to really take a look and measure those successes and see if there's anywhere that you can improve. It helps to ensure its impact, and then we always focus on continual quality improvement to help us expand our efforts over time. So we rely on data-driven decision-making, which involve collecting both quantitative and qualitative qualitative data, such as the seniors not knowing what to do with all of that kale, rather than just making assumptions that we were doing what the community needed. We've also considered data showing that dementia is one of the top 3 causes of death in Greendale, thought about the link between nutrition and brain health and how that links to things in our community. We looked at results from our youth risk behavior survey that's given in our high schools, and does give some data on how many fresh fruits and vegetables students are eating on a daily and weekly basis. We looked at community health assessment data, and then drew on some of the perspectives and feedback that were gathered through community convening sessions, and then the senior social club and gardeners feedback. So to maximize this community impact, it's essential to build strategic alliances through collaborative approach. Megan talked about some of the partnerships that we made. We thought it was really important to develop those partnerships that are mutually beneficial, which allows the projects to reach further and then meet the needs of multiple groups and individuals where we have some shared goals, and we can work together. So by leveraging those existing resources and networks that these partners have, we felt that we could more fully integrate brain health into everything that we do. Also, a positive is this collaborative participation can foster a sense of ownership and responsibility towards those community health initiatives, such as when our community health work groups took over managing the donation process, where health department staff no longer had to do the collection and delivery of that produce. So with that, you really want to make sure that the partnerships are inclusive, they're included in the process, the ideas, the planning, rather than like a directive relationship where you're asking them to do something specific or telling them what to do. And we also found that it was really important to consider other partnerships and collaborations. Some of those, could be local, regional, or national experts, like calling on your Department of Public Works, Master Gardeners, AARP, Alzheimer's Association, and so on. We found that those experts were always really willing to contribute to our project and provide their expertise, which helps move the impact even further. Integrating the education into what's already happening in your community is also an effective strategy. As I said in the introduction, our community is very close-knit, community-driven. There's a lot going on. So rather than adding something new or a new program on top of all of the information, activities, and events that are already happening, we focused on finding ways to infuse it in all that we do. Brain health is it's so vital for everyone. So it's important to share information in many ways that will reach many people. Also, at every stage of the lifespan, we know earlier actions can help reduce those risks later in life. So we used a wide variety of methods. Some of those included articles in school newsletters that went out weekly, community-wide publications. We have both a quarterly and actually we have a couple quarterly publications that go out in our community. So we wrote articles and submitted pictures for those. And then we also had outreach booths at various events. One of my favorite ones I wanted to talk about was at our community theater show. They have a senior night every year. And so we were able to have an outreach booth at that event, which it was very much targeted marketing and getting that information out, proper customized information out to that group. We also, as Megan mentioned, did cooking demos, seminars, really focusing on getting the message out in a wide variety of ways. So through these partnerships and the integrated community education, both access and awareness are increased. Those partners, volunteers, and participants now essentially can become public health champions, and they spread the word about the garden. They talk about the donations. They're also talking about brain health and other related topics. So together we can create this buzz and then continue to nourish minds through our garden initiatives and our information sharing approaches. Next slide. So as I said, we are committed to continual improvement and the flexibility to pivot on any new information and evolving community needs. It's really important and essential to gather and analyze data to guide any future initiatives we're going to take and any direction we're going to move our community garden initiative into. And we want to expand those partnerships and educational outreach, which will help ensure sustained and growing impact. A comprehensive approach to this requires considering the impact at all levels. So individuals who are at risk, those that are affected, the entire community, and also the system as a whole. While the majority of our focus has been on primary prevention, we are focusing on taking strides at addressing every level of prevention. So you can see we kind of put it in a brain diagram here, all of the different levels of prevention and the different populations. So starting with primordial prevention, which affects the whole population or system through public health and policy. Currently, we are working on, with our downtown food market, to accept SNAP or Supplemental Nutrition Assistance Program benefits, and then also educating market staff and participants on the connection between nutrition and brain health. Primary prevention, or at the community level, aims to prevent disease before it develops. Something that we are doing is we are currently expanding our partnerships to include our Park and Rec department. They have a summer adventure club, which is like childcare during the summer for school-age children. And they are engaging in gardening activities every Monday, weeding, picking, cleaning the produce, bagging it up into individual bags. And then they go and they actually deliver the produce to the Senior Social Club, which has been a very great experience for both the youth and the seniors. For secondary prevention, that involves more of the screening and early interventions for at-risk individuals. So something we're doing in that area is partnering with our County Aging and Disability Resource Center to offer memory screenings with their dementia care specialist right here in our community. We'll have slots and invite the community to sign up, and they can come get that memory screening right here in their own community. Tertiary prevention focuses on those that are affected by dementia, so aiming to prevent further deterioration and improve quality of life. We host a monthly memory cafe, which provides support for individuals with early dementia and their caregivers, and that's really well attended with about 25 participants every month. So by addressing prevention at all of these levels, we really are aiming to nourish all minds and create a healthier and happier community for everyone. And that wraps up my slide. So next slide.
I'm on mute again. We just wanted to thank everyone for attending, and thank you so much for this opportunity to share about our community. We could talk in so much more detail about this topic and all of these things. So if you have questions, please reach out to us.
Thank you so much, Megan and Ashley. And unfortunately, it looks like we're right at time. So I do want to allow an opportunity just to highlight where everyone can register for the final two sessions of this webinar series. But again, we want to thank not only Megan and Ashley, but also Dr. Agarwal. Any questions that are pending, we'll be sure to get those answers out. As well as just a reminder, this recording will be posted on YouTube, as well as it will be provided in the recap email. So please stay tuned. If you can, go ahead and sign up for our public health e-news. This is where you'll see the programs that are coming out of the Center on Dementia Risk Reduction, as well as our SDOH infographics, modifiable risk factors, and the risk reduction learning collaborative application. And next slide, please. And then we hope that you can join us for the next session. We will hear from Dr. Crystal Glover at Rush Alzheimer's Disease Center, as well as Patricia Takara, who is with the Minnesota Department of Health. And we'll be focusing on breaking barriers, combating dementia through social engagement. And that webinar session will be on August 28th at 3 p.m. until about 4 p.m. Eastern Standard Time. And we thank you all so much for joining us today, and I hope you have a great rest of your day. Take care.